Only 5 days are left for the November INICET exam. Now, what should be the strategy ahead? Before proceeding, I want to say you this November INICET is one of the easiest exam to crack. Now, why it is one of the easiest exam to crack? Because NEET PG good rankers will be out of the competition. And नया बैच कोई आ नहीं रहा है कंपटीशन के लिए, जस्ट फ्रॉम द एम्स दे आर कमिंग. NEET PG counseling is going on simultaneously, so everyone is going to be engaged in the counseling also, and many will be deviated from preparation of INICT. So, if you can maintain your mental stability at this point of time, then guys, you are going to crack it. Another important thing is that the INICT seats are also increasing day by day. Coming to the target number of corrects, because if you are giving a exam, you should have the direction that how many number of corrects I need to make, how many questions I need to attempt so that I can get the desired rank. So mota mota taur pe this is not the final one, because without the exam no one can tell with how many corrects, how many rank you can get, but this is the consensus that is going on throughout the years. So if you want a top 10 rank, then you need to do 160 plus corrects. If you want top 100 rank, then you need to do 150 plus corrects. If you want top 1000 rank, then you need 140 plus corrects. And if you want top 4000 rank, then you need to go for 132 plus corrects. And always try to make less number of negatives, because in the INICT exam the negatives play a huge role, because one third is negative, not like NEET PG ki one fourth negative hai, one third negative hai. So always when you are stuck between four options, try to rule out options. This is the main art that you should learn, and this could be learned only by solving more and more MCQs. So if you can rule out option 1, option 4, then go and mark. Because if you are confused between two options, mark the one which your first intuition says, because in research it has been shown that first intuition is correct 7 out of 10 times. Now suppose you can rule out only option 4 and you are confused between 1, 2 and 3, then you are in a confused state that whether to attempt or not attempt. Now, if you have attempted within this range 183 to 192, which is the sweet spot, then you don't need to attempt. But if you are attempting less than 180 questions, and then you need to attempt those questions also, so that you can reach the 140 plus corrects mark. How an INICT exam looks like: out of 200 questions, 120 questions will be PYTs, and 10 to 15 questions will be direct PYQ repeats. In these questions, there could be one liners, there are sequence based questions, true false questions, multiple corrects, reasoning assertion, match the following. INICT changes the question type. Sometimes they give more of one liners, sometimes they give more of sequence based, sometimes they give more of true false. किसी किसी साल like the May INICT 2025 they gave multiple corrects ज़्यादा दिए थे, कभी कभी reasoning assertion. So they change the pattern that which type of questions they are going to give. So you should practice all the patterns diligently. 40 questions तुम्हारे RR नोट से आ जाएंगे जो कि PYTs नहीं होंगे. 20 to 30 questions will come from the standard textbooks. No need to read the standard textbooks now, it's of no use. If you have remembered from your prof times, then that memory will be utilized in the exam. And 10 to 20 questions will be unattemptable, means these are meant to leave, like the keynote trial of pembrolizumab which came in our year, or the Barth syndrome. These questions are meant to be left. Comparing the May INICT with November INICT, May INICT is more towards the difficult size. November INICT, since this INICT is meant for the interns of AIMS, so it is on the easier side. And also internship related things are asked more and more in the November INICT, like the cannulas, vials and all. Multiple correct options or true false, these are more commonly asked in the May INICT. November INICT में क्या देखोगे कि one liners ज़्यादा आएंगे. So if the question is easier, then the cutoff can rise. What you should do in the last 5 days, just focus on this 120 questions. Okay, so 120 questions you are going to get from the previous year topics, and you need to revise all the 19 subjects to get those 120 questions. So you can go through my previous year topic list, because in May INICET 111 questions came common from this topic list. The link is given in the description box below. So you need to study the highlighted and the bold mark ones. These are more important, but you need to also study which are not in bold mark. Okay, every topic you should study. This is like a checklist. Like you are starting anatomy, go through the checklist of all the topics and you should cover all the topics from your revision notes, not the main notes. So first day, November 4th, I have kept anatomy. With that is correlated surgery and correlated orthopedics. FMT is also correlated, anesthesia is correlated with the surgery. On 5th, there is physiology, medicine, pediatrics, biochemistry, also inborn errors of metabolism is correlated with that of pediatrics. 6th, pathology, pharmacology, eye and ENT. On 7th, volatile topics like ComMed, OBGY, micro, derma, psychiatry, only the definitions and the cutoff times to call a disease. Like what is the cutoff time to tell it a bipolar disorder or to tell it a schizophrenia. On 8th, what you will be doing is the 20th notebook, bookmark previous year questions and the digital image bank. So you can go through any digital image bank. You can purchase my digital image bank also. It has 1000 plus classical images, and classical images are going to be asked in the INICET exam. Classical images means the images that you can search in the internet. So there are high chances कि ये सारा images जो तुम देख के जा रहे हो वही वाला question में आ जाए. So the link is given in the description box below and pinned comment section. What are the bookmark questions you should be seeing? Not just random bookmark questions. You should be seeing only the 8 years of INICET, 3 years of NEET PG, and study thoroughly the May INICET topics, because May INICET topics से भी 5 से 10 questions आ जाएंगी. Like in May INI 2023, a question on kappa statistics was asked. In November INICET 2023 also, again the question on kappa statistics was asked. In this last 5 days, no need to give any GT, because it is a simply waste of your valuable time. These 5 days are the most high yield time you are going to get just before the exam. So don't waste time on GT, because if you give a good GT, then it is of no use. You need to do review and it will consume a whole lot of day. And if it is bad, then you will be demotivated and you will lose the confidence which you are having within. Custom modules you can do 50 questions, 45 minutes each. You can also join my WhatsApp channel. The link is given in the description box below and the pinned comment section. There I will provide you 50 mixed bag questions which are curated by Marrow. So these Marrow custom modules will be helpful rather than selecting your own custom modules and giving the hashtags. What should be the mindset at this last point of time? Your mindset should be calm and composed, not aggressive, not very much tension or freaky. You should be calm and composed. Last day, sleep early, at least 6 hours. If you are not getting adequate sleep, then no need to worry. But if you are having physical symptoms like headache, then you can go for crocin pain relief, because it has paracetamol and it also has caffeine which activates your brain during the exam. And you can go for PPIs, because stomach problems do take place if you don't have a good night's sleep. Have a moderate meal, not too much heavy, because too much heavy meal will make you feel sleepy. And take the essentials medications with you. Like if you are allergic to something, or if you are having chronic spontaneous urticaria, then you need to take the antihistaminics. So if you are having any condition, then take the medications with you. गो टू टॉयलेट जस्ट बिफोर स्टार्टिंग द एग्जाम. तुम लोगों को ये बात सिली लग सकता है, बट बिलीव करो ये सारा छोटा छोटा चीज़ें मैटर करती हैं. बिकॉज इन माई INICET आई वेंट टू टॉयलेट during my exam. After that they scan, they have to you have to give the fingerprint. It takes 2 to 3 minutes and I missed 2 questions. So always empty your bladder just before starting the exam. And just before entering the exam hall, you can watch my digital image bank once. You can review that, because approximately 10 to 20 same images will come in the exam. So all the best for your INICET exam. And if you haven't watched on how the INICET exam pattern is, then watch the video on decoding the pattern of INICET, which is appearing on your screen.